Hello guys, I'm Dr. Lee. Today I'm going to talk about the bending phenomenon that occur during precise lengthening surgery. One of the lectures I recently gave at PRECICE surgeons meeting in Munich was about analyzing 1,000 cases of precise surgery I performed and presenting the results. There's been 3 versions of PRECICE so far. PRECICE 1, PRECICE 2, and the current PRECICE 2.3 that we use. Excluding the first 2 due to different mechanical characteristics, I analyzed a 705 patient who underwent surgery with the current used PRECICE 2.3 and completed the treatment. Although the analysis is not complete, I analyzed those cases from various angles. Today, among these patients, I will talk to you about how much reoperation rate occurs during bending of the nail. In my previous paper, there was a comparison of mechanical characteristics between ISKD, PRECICE 1 and PRECICE 2. Papers on how complications are classified in limb lengthening surgeries has existed before. Traditional limb lengthening surgeries mostly used external fixation, like Elizarov. So complications from lengthening can be broadly divided into 2 categories. Complications from lengthening itself and complications from the device. However, if the device changes, complications can also change. So separate from the existing classification of complications when using a lengthening nail. If there are issues with the nail that is inside of the bone, there could be scenarios where reoperation needs to be done to replace the nail. So depending on the type of internal fixation, entire different mechanical issues can arise. The paper I wrote was about how to approach device-related complications when using a lengthening nail. External fixation is adjusted from outside, so it doesn't cause major issues usually. But with internal fixation, since the device is placed inside and the lengthening speed is controlled within the bone, the accuracy of the speed control is a very important characteristic of each device. For example, ISKD does not always follow the speed that surgeons desire, which is why ISKD has been withdrawn from the market. One of important features of this lengthening nail is how accurately the device can lengthen at the desired speed set by the surgeon. So that is type 1 complication in my paper. Next, type 2 includes bending of the nail or fractures, which is issues related to mechanical strength. Type 3 includes other problems such as corrosion. This paper was published before STRIDE came out, so before that we included things like corrosion in this type 3 classification. ISKD was withdrawn due to type 1 complication, but with PRECICE 1 there was cases of fractures, so problem arose with type 2. In the case of PRECICE 2, there was a problem at rotation coupling. There was also type 2. We categorized them into 3 main types and then further classified into subtype A, B, and C. Type A had related issues, but they weren't severe enough to require reoperation or surgery to resolve. And type B includes cases that require reoperation to address the issue. While type C includes cases where even after reoperation, the issue was not resulting in sequelae. This subtype concept was given by Dr. Pelly's classifications. We classified them into a total of 9 categories. When presenting in Munich, I didn't fully review type A regarding this bending phenomenon. There were bending phenomena that existed but didn't cause clinical problems. To classify such cases, all the X-ray for 705 patients should be examined thoroughly. So we haven't reached that point yet. We will do that afterward. I will probably need to publish it as a paper. What I prepared for this lecture, cases that require reoperation, because we separately recorded cases that require reoperation. We reviewed and analyzed all of those cases. What I can tell you today is about cases where reoperation was needed due to bending phenomenon of the PRECICE, and which patients were at higher risk for such issues. First of all, there were none among the women. There were no cases at all. I'm not saying that there was no bending phenomenon among women cases, but I don't know how much bending there was actually. Even if there was bending among female patients, none of these cases were clinically significant. Among males who used 10.7 PRECICE nail, none of the patients required reoperation. But among those who used 8.5 nail, 8.3% of the total patient underwent reoperation. Again, in the group of male who used 8.5 diameter PRECICE nail, 8.3% underwent reoperation due to bending of the nail. Among male patients who used 8.5 PRECICE nail, if we divide into femur and tibia, in the group that lengthened the femur using 8.5, 16.7% required reoperation. While in the group that lengthened the tibia, it was relatively low at 3.7%. Therefore, I can say that the group with highest risk is male patient who underwent femoral lengthening with 8.5 PRECICE nail, as they have a significant risk of reoperation. Even among male patients who used 8.5 nails, those who experienced the bending phenomenon but did not undergo reoperation are not included here. That needs to be analyzed separately. Personally, I don't prefer using 8.5 for males, so the overall population using it won't be very large. For male patient using 8.5 PRECICE in the femur, if rounded up, nearly 17% required reoperation, which is quite high. Therefore, for male patient, it's advisable not to use 8.5 for femoral lengthening whenever possible. Personally, I rarely use 8.5 millimeter for males, and I recommend avoiding femoral lengthening if the patient cannot accommodate 10.7. However, if patient insists, despite knowing these statistics, the surgery can be considered. Next time, when I conduct a further analysis including subtype A, and I will examine at what length bending occurred in patient and how severe the bending was. Afterward, I finished writing my paper and I will discuss this later. Regarding the perspective of can patient effort reduce bending phenomenon to some extent to prevent reoperation. Firstly, stretching hard can be helpful because the bending phenomenon itself occurs due to the resistance of surrounding tissues. That strong force causes the bending of the nail. Therefore, the vigilant stretching can be helpful. And also, there will naturally be the differences between individuals with very flexible tissues and those with very tight tissues. However, except for individuals with extreme tissue flexibility, the majority of 90% falls within a similar range. That's why I take all the preventive measures during surgery so that the soft tissues won't be too tight. I don't think there is major difference to these numbers, even if the patient do more exercises. This is for today. Thank you for watching.